Cataract is a condition in which the lens of the eye becomes clouded, resulting in blurred vision. To understand cataract, we need to know the manner in which the eye forms an image. The lens of the eye works like a camera lens. It focuses the light entering into the eye and forms an image of whatever you are looking at onto the retina. The retina is a light-sensitive tissue at the back of the eye. The retina converts the light into nerve signals. These signals are sent to the brain via the optic nerve for image processing. A transparent and totally clear lens will produce a sharp image on the retina. With age, protein strands in the lens may bunch up together and cause clouding of the lens. Due to this, the image formed is blurred due to blocking and scattering of light. This condition is called as cataract. As the clump of protein increases, new lens cells form on the outside of the lens, making it cloudy. The clouded area may grow as time goes by, making it increasingly difficult to see clearly. A cataract can be removed through surgery. Cataract may be removed by one of the following methods: phacoemulsification, extracapsular surgery. Your doctor will advise you whether a surgery is required. Post-surgery guidelines. Do's. Resting is recommended immediately after the surgery. Follow the doctor's instructions very carefully regarding eye drops to be used. Avoid touching and rubbing your eyes or splashing water on them. Discharge, if any, can be cleaned with a clean tissue. Wear dark glasses or an eye patch as instructed by your doctor. Keep the glasses on while awake in bright surroundings until things get back to normal. Inform your doctor if itching, excessive discharge, or light sensitivity persists beyond a day or two. Don'ts. Do not bend down for some time after the operation as it puts pressure on the eye. Do not lift heavy weights or do any strenuous physical activity for at least 3 to 4 weeks. Do not attempt cooking or standing near open flames or intense heating devices for a couple of weeks or more. Allow your vision 2 to 3 days after the operation to readjust and get back to normal. If after that you still have excessive inflammation and redness of the eyes, or are experiencing double vision or blurriness of sight, contact your doctor. Complete healing takes 4 to 6 weeks.